Do you ever think about why you work here? Do you ever ask yourself, am I making a difference? We have tough jobs here, and our organization has been through a lot, but still, we make a difference to a lot of people.
My name is David. I work for the Department of Alcohol and Drug Services.
My name is Marisa Rodriguez, and I'm a health planner. I work for the Public Health Department.
I am a health service representative with the Mental Health Department.
I work at Valley Health Center, and I work in the OBGYN clinic.
I'm Greg Adams. I'm the chairman of the Department of Surgery.
I love patient care. I feel like this is the job that I was born to do.
I love my job. I feel that what we do here really impacts the greater good of the community.
We're really helping the community, Santa Clara County residents at that, and we're allowing them to go back to our communities and be productive and, be themselves.
And that's the things I think we here like to see the most is somebody coming back saying, hey, I'm doing it. I'm doing well. Thank you guys, for all your work that you've done for me. And so it feels good to be part of that team and to be part of an organization that really cares what they do and cares for the clients and for the people that we work with.
What we do is more than just a job. Our work matters to the people we serve and to our community.
The thing that always connects me to the mission is the patients, is their recovery from whatever trauma that they've had or whatever disease that they've had.
A client came in here close to a year ago, and he had been in and out of prison his whole life. He came here to get help. He said at this time he had been 6 months sober, which is very impressive. Said he hadn't eaten all day. We got him some help. One of our colleagues got him some contacts for jobs. Somebody else came out and gave him $15 cash. They don't make a lot of money here, but they offered $15. Everybody knew he was trying. He came back 6 months later, looked great. He had 1 year clean and sober, working full time. You talk a flip side, I couldn't believe it myself. I was so impressed.
There's a patient who is a very delightful, young lady. She is mentally challenged and has been taken care of by her mother practically, all her life. She's childlike, but she's very, very adorable. And her mother passed away. And she came to clinic that day, and she was very sad. She was very tearful. And she said to me, who will, take care of me now that my mother's gone, And unfortunately, she had no one but us. And I just felt that, I wanted to keep her world, as real and as the same, as when her mother was here, working with myself, and the doctors, and, just keeping people that she normally sees, when she comes to, clinic, trying to keep her world as much the same, as possible.
I got a telephone call in the middle of the night about a man who was caught underneath the light rail train, and his foot was caught, and he needed to get out from under the train. And they were concerned that they wouldn't be able to get the train lifted up and that we would have to actually amputate his foot at the scene. Now normally, people come to the hospital. They're seen in our trauma unit or in our emergency department. And there are a couple of occasions that have happened recently where the hospital went to the patient. And it took creating a team of anesthesiologists and nurses and respiratory therapists and thinking creatively about what do you bring to the scene? What instruments do you need? What medications might we bring? The whole team got put together in about 15 minutes, and we loaded ourselves into a police car and went to the scene where the patient was just getting released from underneath the train. They had figured out a way to lift it up, but he was still critically ill. We had to do critical care to make sure that he was safe before we transported him back here. The thing that impressed me was not that we had the capability of taking care of a critically ill patient. We do that every day. It's that we could take that resource to the patient, and we've done that now on a number of occasions. And it takes a huge team to do that.
All you have to do is just walk around the campus here, And patients will change your mind, and they will let you know that the work you do is worthwhile.
So you see patients coming in a fragile, frail state at the very infancy of their appointments, and then you see them as time goes on evolve into these energetic and bubbly people. It really touches your heart. Then you're saying, yes, this is why we're doing this. This is absolutely why we're doing this, and we're doing something right.
Because we really want people to live in communities where they feel safe, where they know they can access affordable, fresh fruits and vegetables. Really encourage them to go out and be active. Our role really in public health is to make it a healthier place for them to live.
At the end of the day, you deal with a lot of emotions from here. First and foremost, you have to deal with the emotions that the patient goes through. The pain, the fear, the anxiety. And once you've alleviated that, then you get a chance to relax and realize that what you've done today and every day has made a difference in that patient's life. And you realize that it makes coming to work in the morning easy. The day may turn hard, but there is something wonderful in every day because of what we do.